Antonio, this is the end of 3 years for you. It would be a good opportunity really to reflect on these 3 years and how you've seen the course develop as you've been in Lisbon.
Well, I can speak in the 2 points of view, mine and theirs, what I think is theirs. And my point of view, for me, it was one of the most wonderful experiences in my life, actually. The interaction and the feeling that we are building something. We are building a new community of internists in Europe, and also I believe a new elite that could push things forward and to make a better future for internists, of course, but mostly for patients in Europe, and a new sense of being European and doctor and tolerant, and with all that we are building a better world, and I believe in that. The second part of this, it's wonderful to understand that they are having probably one of the best weeks of their lives, and as you know, they all individually make a comment to me in the book that they gave me yesterday, and I spent most of last night reading it, and some of them said it was the best week of their lives. So for that I thank them, and I feel proud to be part of it.
As you know, next year we go to London.
Yes.
Have you any recommendations for us when we go to London to try and replicate this success?
Just one. Do it by hand. Don't mechanize it. Do it by hand and with your heart. That I know is big. If you don't try to organize it too much, it will work perfectly, I'm sure.
And this is one of the secrets of success, I think, here in Lisbon, isn't it? The fact that you've had many sessions where there have been free discussions amongst residents.
Yes.
And do you feel that has been a useful development?
It's kind of freedom. You have to give them freedom to say things, and the others to not agree with it. And if you have this interaction, there's no better way to get a friend than the big discussion. So that's where the things happen.
Of course, we are a member of the European Federation of Internal
Yes.
Medicine. Do you see this as a helpful way to strengthen internal medicine in Europe?
I believe right now that this is the best way to increase the importance of internal medicine, because, as I said, we are creating a new elite, in the better elite, I believe.
An elite with wider horizons, basically.
Yes, and with more tolerance, because they know the others are different, but the feelings and the interests are the same.
Yeah. Yes. In fact, as you say, we see more similarities than differences when it comes to patient management.
Actually, the difference are on organization, not on the treatment of the patients.
No. And the other interesting thing is, I think, that although 20 years ago we might have said that internal medicine was dead, it's still very much alive.
Actually, that's different from your country, from mine. Never died in Portugal or Spain, but in Europe I agree with you, and I've heard some people from North, like Stefan Lindgren, our president, saying that it's time to get back. It's time to renew internal medicine, because all this drive into subspecialties was made especially to the interests of organizations and doctors, not patients. So we probably have to rethink about everything, and to put an input, a strong input in general internal medicine.
And I think that's a crucial point, that actually both in Alicante and in this school, the focus has been on patient management and not what suits doctors. And I think that is where internal medicine is so strong.
That's why the clinical case discussions are a strong part of ESIM.
Thank you very much, Antonio, for all the work you've done in this course. It's made it such a success. Thank you.